Hello, hi, namaskara. My name is Kirtan and I am a second year medical student studying in a government medical college. Today I am going to talk about the second part of the electrocardiogram or ECG video. The first part I had already uploaded. I will provide the I button link in the video. So let's start this video. In this video I will talk about mean Qrs axis, the abnormalities which can be determined by the ECGs and his bundle electrogram. So let's start. The mean Qrs axis. So what is it? It is the record of the magnitude and direction of the mean cardiac dipole or the vector. So it ranges between minus 30 degrees to plus 110 degrees. So it is a visual representation of the decrease of the mean Qrs axis. The factors affecting the mean cardiac vector or the mean Qrs axis are the position of the heart, the properties of the conducting system of the heart, the electrical properties of the ventricular myocardium, and the muscle mass of each ventricle. So the mean Qrs axis is roughly measured by the lead 1 ECG or the AVF ECG. It is accurately estimated by the Enthovian triangle. So I will not be talking about the measurement of the Qrs axis in this video because it comes in the practical part of the physiology. So this is the visual representation of the axis, the normal axis of the mean Qrs axis. So if the deviation is less than the minus 30 degree, it is called as the left deviation, and if it is more than the plus 110 degree, it is called as the right side deviation. So now let's talk about the abnormal ECG. ECG is very useful in determining many cardiac abnormalities like cardiac arrhythmias, myocardial abnormalities, effect of the electrolyte disturbances, and secondary diseases to the heart or etc. So I will be talking about two main abnormal conditions seen in the heart which can be determined by the ECG. These two diseases are most asked in the examination. The first one is the sinus arrhythmia. It is a normal physiological phenomenon and it is the alteration in the heart rate due to the respiratory cycles. So what is the mechanism of this sinus arrhythmia? There are mainly four main mechanisms for this sinus arrhythmia. The first one is the alteration in the autonomic activity. So in sinus arrhythmia, the heart rate increases in inspiration and the heart rate decreases in expiration. So in the alteration in autonomic activity, when there is inspiration, there is depression of the vagal system. So during inspiration, depression of the vagal system leads to the increase in the activity of the sympathetic stimulation. So due to the sympathetic stimulation, the heart rate increases. Whereas during expiration, the opposite happens. The vagal system is stimulated and therefore there will be decrease in the heart rate, because the vagal system acts as the depressor of the heart rate. Stimulated vagal system that decreases the heart rate. So the next mechanism or the second mechanism is the irradiation from the inspiratory center. So the inspiratory center, which is nothing but the respiratory center located in the brain, releases impulses which goes to the cardiac center and stimulates the heart. So it thereby increases the heart rate. So it can also be spillage of impulses from inspiratory center. The next mechanism is the activation of the brain bridge reflex. So during the inspiration process, the intrathoracic pressure decreases and therefore the volume of blood reaching the heart increases. So due to the increase in the volume of blood reaching the heart, there will be stretching of the arteria. So therefore there will be presence of atrial tachycardia receptors. Tachycardia is nothing but the increase in the heart rate. So these atrial tachycardia receptors senses this stretching of the atria and therefore increases the heart rate. So this mechanism is called as the brain bridge reflex. So the next mechanism is the atrial stretch reflex. It is similar to the brain bridge reflex, but in this there is stimulation of the atrial stretch B receptors. So this also increases the heart rate due to the atrial stretch. So the next abnormality seen in the heart, which is detected by the ECG, is the conduction blocks or the heart blocks. There are mainly three types: primary degree conduction block, secondary degree conduction block, and third degree conduction, or you can also call it as AV block. So in the first degree heart block, there is prolonged PR interval. So this is due to the delayed AV node conduction. Due to the delayed AV node conduction, there will be prolonged PR interval. As you can see in the graph here, see, this is the P wave, and there is increasing or prolonged distance between the P wave and the starting of the QRS wave. So this is called as the primary or first degree heart block. The next one is the second degree heart block. It's again divided into Morbid's type 1 and Morbid's type 2 heart block. In the Morbid's type 1 heart block, the PR interval is prolonged till the QRX beat is dropped. So it is prolonged continuously till the QRS beat is dropped. So when the QRS beat is dropped, the cycle again repeats. So this cycle is known as the Wenckebach phenomenon. So you can see in this graph, this is the Morbid's type 1 graph. So here the PR interval increases continuously and progressively. So after the QRS interval is dropped, this phenomenon again repeats, and this is called as the Wenckebach phenomenon. It occurs in the acute inferior myocardial infarction and the digitalis toxicity. Digitalis is a drug and the acute carditis disease. The next one is the Morbid's type 2. All arterial impulses are not conducted to the ventricles in this type of heart block. In this, the ventricular beat occurs in every 2 or 3 arterial beats. So therefore, it's also called as the 2:1 or 3:1 heart blocks. So you can see in this graph, see here the P interval, there is missing of QRS interval. So therefore, every 2 or 3 arterial beats, you can see the ventricular beat. So here you can see the QRS complex. Here it's again missed. See, like that there is missing of the ventricular blocks, ventricular heartbeats. So it occurs due to the acute anterior myocardial infarction and degenerative disease of the conduction system. The next one is the third degree heart block. It is also called as the complete heart block. So why is it called as the complete heart block? Because there is no signal transmission from the atria to the ventricle. So there is complete absence of the signal transmission. So therefore, the atria will beat separately and the ventricle will beat separately at different times. So there is no coordination between the P interval, P wave and the QRS wave. So therefore, it's also called as the complete heart block. It occurs with the disease in the AV node or disease in the infranodal areas, infranodal or region. So now after talking about the abnormalities of the heart which is seen in the ECG, now let's talk about the His bundle electrogram. It is nothing but the record of the electrical activities of the His bundle. So why should it be measured? It is compared with the lead 2 ECG, that is the normal ECG, to determine the electrocardiographic intervals for better diagnosis of the heart blocks. So to diagnose better heart blocks condition, we can use the His bundle electrogram. So there are mainly 3 deflections in this His bundle electrogram. Those are A, H and V. The A deflection stands for the activation of the AV node. The H deflection is the transmission of the impulse through the His bundle. And the V deflection represents the ventricular depolarization. So now let's talk about the intervals which are seen in the His bundle electrogram. PA interval. This is nothing but the interval from the beginning of the P wave till the A wave, A deflection termination. So it is the time of conduction from the SA node to the AV node. So it signifies the time of conduction from the SA node to the AV node. So what is the duration? It is 27 milliseconds. The next one is the AH interval. It is nothing but the duration of the termination of the A wave till the termination of the H wave. So it signifies the time of conduction through the AV node. The duration is 92 milliseconds. Then comes the HV interval. This is the time of conduction of the impulse through the His bundle and branches. It is nothing but the duration or interval from the termination of the H wave till the initiation of the Q wave, QRS interval or Q wave. So it can also be called as the HQ interval. So what is the duration of this? It is 43 milliseconds. So this is the graph of the His bundle electrogram and it can be compared with the normal ECG. So that's it for today, guys. I have cleared the entire topic of the ECG, which is important in the board examination. So I hope you found this video informative. Please like, share and comment, and also don't forget to subscribe to support me for making physiology easy, simple and understandable. Thank you.